seat. How are you today?
Pretty nervous.
You a little nervous?
Yes.
It's okay to be a little bit nervous. Tell me a little bit about yourself.
Well, currently I'm a junior. Applying to medical school for fall of 2013. Kind of holding off on graduation to fulfill a communications minor along with my biology major to kind of strengthen some of my weaknesses in the English field. I had problems in the beginning when I started. I've had trouble.
With English?
Probably just my freshman year. I kind of over-anticipated the university.
What do you mean by anticipated? What do you mean by that?
I thought it was going to be easier than it actually was. Or maybe at the time I was a little...
Do you mean college or do you mean English?
Probably both.
Well, did you have some kind of a language barrier?
It wasn't a barrier. It was more of kind of a combination of procrastination and trying to make the paper as professional as possible, and it would kind of not turn out as spectacular as I'd hoped.
So you think you're a little bit of a perfectionist?
I would consider that.
Yeah. What did you do to sort of overcome your barrier? This that you're telling me about.
Well, took quite a while. Pretty much, I was influenced by a lot of some of my closer relatives. I think the biggest impact was when I actually visited my family, my relatives back in Canada, and seeing how much expectation they have for me. But I'd say I was always interested in the medical field, but I think I was a little cocky, and I'm thinking I was too smart for this college, or the college I was entering.
But you came to this college, so what made you decide on coming here?
Well, I think it was mostly my parents' influence for this. Kind of wanted me closer at home, because I guess they kind of knew that I'd have problems, and kind of protective over me.
They're your parents.
Yeah, they're always looking for my best interests.
So you think are your parents there in San Antonio then?
Not really. They're in Del Rio. It's kind of it's a city in the border side between Mexico and the U.S., kind of in the southern western region. But it's about, I think, 130 miles away, so it's relatively close, closer than Austin or other universities.
Do you think that they're your support group? Do you think they're the ones you rely on whenever you need help and those kinds of things?
Yes.
The most?
Yes. Every time when I do have problems, like with what I would see in the future, I'd always ask them for advice, but it's pretty much my decision, like on what I want to do in the future. But because they have experience, because they were born in the Philippines, relatively poor, so they were always wanting the best for me and my brother. And when we were young, they were always pushing us to fulfill a medical career, because they themselves are registered nurses. And my mom was actually a pre-medical student, but under some circumstances I'm not quite aware of, she decided not to fulfill it. So I guess they kind of just they know I have I guess they think I have, or know I have the ability to actually become a physician, or for lack of a better term, a better field than a nurse, because how they would describe being a nurse.
And that would be my next question is, since both of your parents are in the medical field and they're both registered nurses, why wouldn't they push for you to be a registered nurse?
Actually, because they would always describe, I can kind of say this term for term, wiping people's butts. Like, they kind of dirty, the word, like, kind of, they knew or they think I wouldn't be happy with that position.
Would you?
I'm not quite sure. I would think so, because it's a relatively respectable profession. And I guess they just, I'm not quite sure, because really, I think a lot of my family or my relatives were nurses, or in the next generation were nurses. And I guess they're just expecting some more out of me.
Your potential.
Yes.
So, do you think that you want to pursue a medical career as a physician because you want to do it, or because your parents are asking you or pushing you to do it?
I think it was a combination of both, since they introduced me to the medical field at a relatively young age. I got to see just the atmosphere, or the environment of the hospital. So it's something that I want to see myself in, and it.
I mean, you can see yourself in a hospital as a nurse. You can see yourself in a hospital as some other type of clinician, a laboratory clinician, something, a phlebotomist, whatever. I'm just trying to figure out if you can see yourself as a physician, as a doctor in a hospital.
Oh yeah. Can you clarify a little bit?
Well, because I'm trying to figure out whether or not you want to be in a hospital because you want to be a doctor, or you want to be in a hospital because you want to be a nurse, or you want to be a laboratory technician, or you want to be an X-ray technician. You know, there's many areas that you can be in a hospital for. But you know, I want to figure out what your motivation is to pursue a career helping people, but a career specifically in as a physician.
Oh yeah. Well, I have been considering if I were not to be accepted as a PA, a physician's assistant, because it's just the ability, or what's the word? You're given that privilege to be. You have such an intimate relationship with your patients. It's something that I don't really think is kind of a job. It's more as a responsibility, but it is a really fulfilling career, and I would see myself in one of those positions.
So, what do you think then would be the main reason, the specific reason that in your brain you decided, aside from your parents pushing you and aside from the fact that you see yourself in a hospital and those kinds of things, what do you think was the turning point for you where you said, you know what, I don't want to pursue law school, I don't want to pursue, you know, something in music, I don't want to be a teacher, I don't want to be a police officer, I want to be a doctor. And you know, at what point did it click in your brain that you're like, no, I completely want to commit myself to going into a medical career as a physician?
I'd say like a complete decision.
Whereas you were convinced that I'm going to take an MCAT and I'm going to study and become a physician. What clicked in your brain that made you to make that decision?
I think it was about, even though I was being influenced, I think it was about 2 years ago when I actually started committing and started actually concentrating in school more dedicatedly. And yes, yeah.
Is it because of school? Is that what convinced you? Was it an academic experience that you had then that said, I want to go to medical school. I don't want to go to any other school. I don't want to go to PA school. I don't want to go to I want to go to medical school. Was it because of your courses?
Yeah. Yes. I think I was really influenced by one of my professors, Dr. Jordan, kind of influenced like the difficulties, but the rewarding experiences you will have as a doctor. And it kind of made me push harder to try to, unfortunately, focus less on my social life and more toward my academics and beyond, because I have been reading some just everything pertaining to medicine, and it's really interesting when you actually understand it. And just from the course of my learning, I started understanding better, and it kind of made me thrive more to become a doctor.
Okay. So we know that the rigors of medical school are going to be very challenging, and anybody will tell you that. And you said that you've dedicated to more academics and trying, spending more time with academics and dedicating yourself more to that. But oftentimes, medical students, even doctors, after they're finished, need to find a way to relieve some stress, because it's a very stressful situation, especially during medical school. What do you do to relieve stress?
Well, usually when I have the time, I haven't had most of the time recently, was I play golf. So although it's kind of stressful, it's a really fun sport.
Well, golf is actually what the president uses to relieve stress. So apparently, as in Obama, and presidents use that as their stress relief, right? So it is a good stress relief sport that people use for that. So if you play golf, then that's a good stress relief. Do you have any, other than school and other than science, do you have any other extra hobbies that you are involved with?
Extracurricular, like volunteering.
Sure.
Oh yes. Usually in the summer, would you be saying like during the regular term or?
Whenever, right? During your off breaks, or maybe on the weekends. What do you customarily do on the weekends aside from studying? What do you do to kick back?
Oh, so it's beyond volunteering.
Sure.
Really just kind of I kind of talk to my relatives and some of my friends, but really it's kind of more academic-based friends, unfortunately. But usually it's just socializing